and of course in this pandemic. For the COA report, we take this seriously. The recommendations, we take this as a way of making sure we can improve our services more, because this will actually be better for our policy and reforms and fund management. And we all promise to COA that we will, or commit to them, that in 60 days we will give them the necessary documents and the compliance that they need in terms of the implementation, because some of the implementation needed some supporting documents because of this pandemic. And also, we are, Secretary Duque has also mentioned it in this meeting that there is a need for 3.6 billion for the health workers augmentation and to continue the health workers that we hired from January to June. So we must be able to provide them a support again from July up to December. And we would need 3.6 million because 10,500 workers are already positioned across the country as nurses, doctors, medtechs, and so forth. And we will also be adding vaccinators and biosurveillance officers to our list. So that's the reason, Mr. President, that we're asking for this fund so that we will continue with our response for COVID. And also, we have also the Secretary Lucas also asked and requested DPM for the SRA for specifically for those private healthcare workers who are not able to receive, since some of the hospitals were not able to give their validated list to the regional office, because this is the basis for us to give the necessary allocation to the regions once they have the validated list of those healthcare workers tending to COVID patients. So we're asking them again to provide us the list. We're trying to compile this, and this would lead about 11 or 50 million to make sure that this number of health workers will be able to be provided with the SRA has been given to their other co-workers in the health sector. So that is all, Mr. President, and we are very happy that the DBM has been consistently also supporting us, and the different agencies are all supporting us in terms of our response, because we do believe that our strategy of the PDITR, which is the prevention, detection, isolation, and treatment, is really the only strategy for this COVID-19. There's no other strategy but make sure that we are able to prevent this virus from transmission, and definitely also increase our vaccination. That's all, Mr. President.
Before you go, can you listen to me? This is why COA should be kind enough to understand the situation of the DOH and other departments of the executive department. Alam mo, it's not easy. By the way you narrated that ngayon, we are willing to pay, but you need to have the list and everything. At alam mo, you have to validate it. Ang validation niya, so with so many thousands, you cannot just come up with a list that's the final in 1 day or 2 days na ito na yun talaga. Kasi ang validation would take, I really do not know how you do it. But I commiserate with your, you have this shortcomings, I can understand. But ito lang ang tandaan mo. Magkalit-diretso man sa buhay, we are just on track, serving the people. At yung ano lang ang kaya natin, kung ano lang ipakita natin sa tao na humanly possible. So, kung they refuse to understand or they understand the situation, I said, give us enough elbow room to move, because it's not what you're asking is not easy really to come out with. And secondly, yung utos mo na bayaran lahat sa mga allowances and whatever, you can source it from everywhere you want. But ito yung you can get it from my contingency fund. And that's the reason why again, once it stays to the people, my pocket policy. What I said that I was asking for it because I will use it as a campaign. Wala akong kandidato. Wala kung sino tatakbo. You know, bagay, politika. But I pity them because they can never be president. These politicians behave the way they are now. I can assure you, they can never be an administrator of the country. Kung sila yung tingin ko, they will govern Mr. Rodrigo. Ngayon, pag kinabukasan, ang chief of staff, ang presidente na. Yung natotoo talagang, you're not the only one thinking about this country. These guys on the side, watching you also. No, you do not allow the country to go into a downhill turmoil. We have to borrow, beg, steal. Kung maghanap ka ng pera and any deficiency, I will supply it to the contingency fund. If may naiwan pa, so I'm willing to share the burden on sa funds ko, independently of what you have. You just raise the money, tell me how much you still need, and if I can provide you, pay immediately. Papel na naman yan eh. Or even put the letter panos, kung gano'n. So, babayaran ka agad yung mga nurses, pati yung tawag nila, vaccinator.
Mga sir, mga healthcare workers augmentation, kasama na ho yung vaccinators pa. Healthcare workers augmentation.
Basta mabayaran ninyo lahat, nadagat to billions. But look for the money, and I said I'm willing to share the budget with you. With that, we end this meeting, and I'd like to thank everybody, you guys there. Thank you for sharing with us the time. At least, I may not have given you the time to say something, but getting late, and you know, ang karamihan dito sa ano lang is they are past the retirement age. Kaya nga nag-retire kaya nga dito nagtatrabaho ulit. So, maintindihan ninyo that this is a matatandang magiting na mga lalaki. Salamat, Dr. Rodrigo. Good night to everybody.
Thank you, Mr. President.